Okay, we're here today with Dr. Neuberger, which is practicing cardiology over 40 years in Borough Park, but now we have him here in Parcare. Dr. Neuberger.
We do a number of things. As a cardiologist, we do three basic things. We work to prevent heart disease, we work to diagnose heart disease, then we work to treat heart disease. Heart disease is not just the heart, it involves the arteries and veins, so we take care of illnesses that affect the veins and the arteries in the legs and the neck and other parts of the body, and that constitutes what keeps a cardiologist busy. Some patients have no heart disease and they have no symptoms, but they are aware that they have risk factors, either due to high cholesterol or diabetes, or unfortunately they've been smoking for many years, and they want to learn what they can do to prevent developing heart disease. And that, in many ways, is the most important thing we do. Preventing illness is always much more successful than treating it.
Right, I know there's a new organization, doctor. It's called, I forgot the name offhand, but basically they're into prevention. And they want people to come to doctors and check themselves out at least once a year just to prevent illnesses. So you recommend that as well?
Yes. Everybody should know themselves and should know whether they're at risk. We talked about the specific risk factors, and also there are some families who, without doing anything wrong, have a lot of heart disease, and those people need a little extra attention as well. Then the next group is patients who have symptoms, and that's difficult because you don't go to school to become a patient, but generally what happens is a patient feels something he hasn't felt before. Heart disease occurs at a point in time. In other words, you don't start having heart disease when you're 10 years old or 20 years old. You're born healthy, and then at some point you develop a new symptom. It could be trouble breathing or palpitations or a chest pain. It's very hard to be specific because every patient feels their symptoms differently. The trick is that your person is feeling a symptom that they did not have before, and that's a signal that something might need attention. For example, if somebody gets the flu, it's not frightening. They feel very sick, but they had the flu 10 times, so they know they've had it before.
Right.
If somebody gets a chest pain from their heart, well, that'll be something that didn't happen a year or two ago, and that'll give them a tip off that maybe this chest pain or this shoulder pain.
You should come check it out. And as of now, doctor, you're in Borough Park for 40 years, but you're new in Parcare, and that's something that anybody could come and get checked out by the famous Dr. Neuberger in Parcare, which is a real specialty. And the community is very excited about that doctor. We're very happy that Parcare is offering such an amazing service to having Dr. Neuberger in-house over here in Parcare. If there's one thing, doctor, that you're, over your 40 years of practicing cardiology, one thing that you could recommend for people, you've seen it all, to stop doing or to do to prevent heart disease?
To stop doing is easy. There's two things they should stop doing. But a small number of people in Borough Park are still smoking. They should please stop smoking.
So I see, and you and Mr. Schwartz could get together. There's somebody, Mr. Schwartz, Mr. Schwartz is also very against it. Maybe you partner together with him to cancel out the smoking in Borough Park. And what's the other thing?
The other thing is our caterers are wonderful. Our wives are wonderful. The food is wonderful. It's just that it's too much for us, and we have to. Everybody has to try to design some strategy by which they keep their weight down, and that minimizes the amount of high blood pressure, and minimizes the amount of diabetes in the community.
Amazing, yeah. Especially Shabbos, Yom Tov, Hanukkah, All right, that's why Parcare opened up also a gym downstairs.
that should be very helpful.
Mitzvah Shem. All right, thank you so much, doctor, for being here for the community, for always helping the community, for keeping us healthy and safe. Have a great day, doc.